Evaluating the critical exotic companion mammal. Many exotic animal species are prey species, and they tend to hide the signs of illness until the disease condition is advanced. So many will present for an apparent acute presentation, which is actually more chronic in nature. Disease secondary to improper diet and poor husbandry are also much more common with our species. S- Partially because the ideal diet for some exotic pet species is currently unknown. The critical patient, most sick patients that come into your practice will usually benefit from supplemental heat, always watching for worsening of any respiratory symptoms when we're providing heat, oxygen, and a semi-dark, quiet environment that's as stress-free as possible. And in many cases, we delay the full intensive examination in order to reduce the stress of these very sick patients. Fluid administration for the critical patient is also extremely important, and we need to keep in mind that the recommendations for humans and veterinary critical care specialists is to get vascular access as quickly as possible, either IV or IO. However, we've learned from experience that many very sick exotic patients will not initially tolerate this. So the choice of actually giving fluids depends on overall patient condition and what you expect the patient is predicted to tolerate. Oftentimes, we resort to simple rapid sub-Q administration in these very sick patients. So for fluid administration, it's very important to offer warmed crystalloids, and many times, again, we need to give the initial bolus subcutaneously, despite the fact that this technically may not be the best thing to do. When we give the sub-Q fluids, we need to rapidly administer them to reduce the stress in handling. So the way we do this is to use a larger needle than you would usually pick up for the patient of that size. We want the fluids to go through that needle very quickly so that we can put the patient down and stop handling them. So sometimes we're using 22 to 18 gauge needles, and I'll even use a 22 gauge needle in something as small as a hamster in order to get those fluids in very rapidly. You use a smaller needle, you increase the time required to administer the fluids and increase the handling and stress. So for the critical exotic patient, the next step we have to remember is that both handling, treatment, and sample collection and not handling, providing treatment, or getting samples might result in a negative outcome. So what are we to do? The next step, it's helpful to classify sick patients as to their actual condition to help you make decisions. In one category, we have the bright and responsive patient, that in your practice, as presented, the patient looks bright and responsive, even though the owners have reported that the patient is not well. We also have the patients that are quiet, but still fairly responsive. Third category is the patients that are depressed and really very minimally responsive, the fourth being the non-responsive patient. For the bright and responsive patient, we feel fairly confident we can proceed with diagnostic testing and treatment right away. However, many times we want to consider sedation, especially if we're going to start taking blood samples, diagnostic imaging in these very small exotic patients, because even with very healthy patients, doing these things can be very stressful. So in this case, we're going to usually default to very low, creeping up to maybe routine dosages in these bright and responsive patients, and proceed stepwise. Watch what you're doing every moment and be prepared to stop if this patient shows any signs that we're decompensating. Sedation, just a quick side note for that, low-dose sedation is wonderful in that it often reduces the stress and risk associated with handling these very sick patients. We will choose dosages primarily based on the patient condition, also the species in question and how comfortable you are with sedation, but mostly on patient condition. With sick patients, always choose lower dosages. If you need to, you can always increase this incrementally. So, for the average sick exotic patient, regardless of species, we may want to think of dosages anywhere between 0.25 and 1 milligram per kilogram. Another beneficial thing to do is to combine these with an opioid. Why? When the two are used together, they are synergistic and they work better, and we can use lower doses of the two when they're combined. When in doubt, Consider butorphanol anywhere from 0.2 to 0.4 milligram per kilogram. Again, the sicker the patient, the lower the dose. In order to reduce stress of handling, these two drugs can be combined into one syringe, injected rapidly IM using minimal restraint in handling. Much more information on sedation is available in the accompanying presentation entitled Sedation. The next category is the quiet but responsive patient. This is the patient where handling often is seen to worsen the clinical condition. If the handling produces any struggling or stress, these are the ideal patient for low-dose sedation, again, as discussed earlier. We have to watch for rapid changes of condition anytime we're handling. Be prepared to stop what you're doing and set the patient down and then reevaluate and come back later. When we have depressed and minimally responsive patients, we might be able to proceed and get diagnostic testing without any sedation at all. Again, we have to watch them carefully and see how they handle and react to what you're doing to them. If the handling produces struggling or stress or worsens the condition, then stop and consider the very lowest dose range for sedation. In some cases, we might even think about a single agent, just using the midazolam. For non-responsive patients, if there's no response or worsening with handling, go ahead and place an IO catheter after a local block, begin your fluid resuscitation, and begin treatment of that patient. For vascular access, intravenous access is often very challenging, especially in these small hypovolemic patients. So for this reason, interosseous is often a much better choice for these critical mammals. Studies in humans, mammals, and even some exotic species demonstrate that the bioavailability in circulation is identical to the use of intravenous administration. For more information, see our accompanying presentation on vascular access. For patients in respiratory distress, administer oxygen either by mask or flow by oxygen, or actually in a chamber. Do not stress any sick patient by trying to put a face mask over their face. If they actually struggle and resist, stop and use a chamber instead. Also, this is an excellent place to consider low-dose sedation to reduce anxiety. This is often extremely beneficial. In many cases, the actual respiratory distress is reduced after the patient is sedated. In this movie, we show you a rabbit with extreme dyspnea. The first step for this rabbit was to immediately place him in an incubator with oxygen. If you can see with this patient, it's difficult to even stop and drink. He can barely stop to take that actual drink, as it means stopping breathing. This is the same patient after low-dose butorphanol and midazolam, and you see we haven't worsened the respiratory distress at all. This is the same patient for radiographs. In this case, we're taking dorsal ventral radiographs instead of ventral dorsal. In this case, the patient is tolerating this well, and we can get a diagnosis of a heart-based mass, which ultimately turned out to be a thymoma. Here's radiographs from this or a similar patient. Here we have another movie of a similar condition in a hamster. This hamster has extreme respiratory distress. This is the same hamster after a low dose of midazolam and butorphanol. And in that final image, you see the radiographs. In this case, we have cardiomegaly. Drug choices for exotic companion mammals, especially the critical patient. Use discretion on whether or not antibiotics are actually indicated. And watch for specific antibiotic contraindications in some exotic species. For instance, oral penicillins in rabbits and other hindgut fermenters are not used and not recommended at all. In general, if in doubt, enrofloxacin is generally tolerated well by most exotic companion mammals. You see here the cover of the Exotic Animal Formulary, this version that's out in 2018, the 5th edition, has some good guidelines for drugs for use for exotic mammals. Analgesic choices for mammals. Analgesia is often included in the sedation protocol that we discussed earlier. There is some great information for dosages for selected opioids and meloxicam in various exotic mammal species. We have some pharmacodynamic and pharmacokinetic studies and a few efficacy studies as well. So, when in doubt, though, butorphanol and meloxicam often are good choices, and we want to consult with an exotic animal formulary, especially an updated formulary for information on dosages. Avoid meloxicam in dehydrated patients or patients that are suspected to have renal dysfunction. Our diagnostic workup will proceed when the condition is optimized or it's as good as you think we're going to get it. Plus or minus sedation anytime you think handling is likely to produce struggling or stress. And don't forget also venipuncture in a cold, dehydrated patient is often unsuccessful. For more information, see the accompanying presentation on venipuncture in exotic companion mammals.